All right, so we're going to get back and finish our skin disorders, our integumentary system disorders. We'll finish these up in this video, I hope, if it doesn't run too long. So we were to dermatitis yesterday. So dermatitis is something that you have all experienced probably at some point in your life or will at some point. This is just inflammation of the skin. So remember your medical terminology, and those of you that are going to take second year next year that are not seniors, you'll spend a lot of time with your medical terminology. But derm means skin, A is that A or is the connecting vowel, and itis means inflammation, so inflammation of the skin. This is going to cause dryness, itching, erythema, which is redness, and rash. This can be caused by any substance that irritates. So it could be a detergent that you're washing your clothes in, cosmetics, pollen, certain foods. And it just looks sort of like this. You may have had something like this on your skin before, just itchy, dry, red, maybe from a Band-Aid that caused a little contact dermatitis is usually what doctors call it. It's just where something, you're allergic to something in that. And sometimes it can be really difficult to figure out what it is. Could it be, a lotion you're using? And sometimes it can be something that you've used for years or a patient's used for years, and this just all of a sudden they'll develop an allergy to. I used a certain type of eyeshadow for years, and then all of a sudden I developed an allergy to a dye that was in it, and now I'm pretty much allergic to all eyeshadow. So I have to use some hydrocortisone on my eyelids a pretty good bit to keep them from looking like this right here. So dermatitis can develop over time as well, or allergies can develop over time that cause dermatitis. All right, eczema. Some of you may have had this or known someone who did. This is non-contagious inflammation causing dryness, erythema, again, it's redness, edema, which is swelling, itching, crust, and scaling. This is usually really, really itchy and really bothersome. It's also caused by allergens or irritants. So this is it's non-contagious. But it sort of looks like it could be contagious. But if it's true eczema, it is not contagious. It's really almost your immune system is overreacting and causing this. Can be diet, cosmetics, emotional stress for someone who has eczema. Emotional stress makes it much worse. Can be caused from medications, soaps, especially diet for people that have food allergies or kids that have food allergies. Eczema is they definitely have eczema. Sometimes it'll present itself that way, and then a parent will take their child to the doctor, and then they'll send them through allergy testing to figure out what food it is they're allergic to. Okay, impetigo. This is caused by strep or staph, and you have to treat it with oral or topical antibiotics. It could have started out as a dermatitis. It could have started out as a mosquito bite, but then scratching it and breaking the skin barrier can then cause staph or strep bacteria to get into the skin. So I can remember when mosquitoes love me. Like I have to wear, anytime I'm outside in the summer, I have to use mosquito repellent. And I can remember my mom not wanting to say, don't scratch your mosquito bite, so you'll give yourself impetigo, which I had no idea what she was talking about. But this is what she was talking about. So, and you see the picture here is of a baby, because, if a baby's itching, they don't know, you really can't make them stop itching. They rub their face against blankets, they scratch their face, and it's just really, really difficult to keep them from getting something like this. So oral and or topical antibiotics like Neosporin, Polysporin. Okay, psoriasis. You may have seen commercials for this on television for the medications that treat it. This is a chronic skin condition caused by an overactive immune system. It looks terrible. but it's absolute, and it, you know, if it's in your hair, which a lot of it is in hairlines in the front, it's also going to cause dandruff. But it's absolutely just caused by an overactive immune system. This can, you know, not only the, you can just imagine the embarrassment of something like this. So not only is it a physical condition, but can also cause a psychological condition. So the treatment is biologic or systemic meds. Phototherapy, that's like sort of like the tanning bed, only, you know, not as strong. And then topicals, corticosteroids, coal tar derivatives. But these, you know, kind of the first thing you're going to do is treat it with these. But it usually only helps for a little bit, and they have to move to these biologic or systemic meds. And I mean, most of the time they can't get their skin completely clear, but clearer is better. So if you ever see someone, you know, like this, just try to have compassion and not think that they're dirty or anything like that, because it's just totally an immune response, and I'm sure they're doing everything to try to get rid of it. Ringworm, not a worm, caused by fungus. It is highly contagious. And because it is a fungus, it has to be treated with antifungal meds, not antibiotics or anything like that. This can be very, like I said, it's highly contagious. This can definitely spread very quickly amongst children that are playing sports like wrestling, or on those mats in a warm, moist environment where that fungus just thrives. That can definitely spread to all different people, all different kids. Anytime kids or even adults are sharing sweaty equipment, ringworm can definitely spread. All right, verrucae, or this is just the technical or medical word for just warts, common warts. Warts are caused by viral infections, not frogs or anything else. There are various types of these, and they may go away on their own. They may disappear spontaneously, but some may have to be removed with electricity or liquid nitrogen, acid, or even a laser. The liquid nitrogen, that is what I was talking about for basal cell carcinoma. Also, they just zap it with that, or, you know, just like with a Q-tip, and it burns. I mean, yes, it definitely burns, but it does get rid of it. So here are some different types of warts. Just common warts on the hand there, flat warts on the nose, and then plantar warts. Now, plantar warts are a little bit different. That's on the bottom of the foot. If you've ever had one of these, you remember it. They are extremely painful because it's like you're stepping on a Lego. If you've ever stepped on a Lego, it's like stepping on a Lego over and over and over. And so they're really painful, and they have to be popped out. Like you actually have to go to a podiatrist, and they really have to get to the core of it and actually pop out the entire wart. All right, so an ulcer. This is where we're going to kind of land and spend a good bit of time talking. An ulcer is a deep loss of the skin surface that may extend into the dermis. They can cause periodic bleeding and the formation of scars. And there are certain people that are at risk for these. Diabetics. So here we go back with what we just learned about in nutrition, of controlling our diet and exercise so that we don't become type 2 diabetics and end up having issues with ulcers. Those also at risk are those that have peripheral vascular disease. And you may not know what this is, but varicose veins is a form of peripheral vascular disease, those big, large, bulging veins on people's legs. And then decreased mobility also puts people at risk for ulcers. So here's one on the foot. Okay, so what is a decubitus ulcer? This is also called a bed sore. So obviously our nursing home patients get these, people that are immobilized because of paralysis or something like this. This is something that you have to be cautious of, but it can happen very quickly. So it could also be a patient in the ICU, a patient on the ventilator, anything like that. You have to be watching out for decubitus ulcers. So it's caused from poor nutrition and pressure on the skin over a bony prominence, just from laying in the bed over a bony prominence. This decubitus ulcer or a bed sore or a pressure ulcer, all those words are synonyms. All of those can happen. Poor circulation is something else that causes it, which comes from diabetes. So if you've got your nursing home patient that's diabetic and has decreased mobility, they're definitely a perfect candidate to get one of these decubitus ulcers. But also just a patient that maybe they've had a heart attack, maybe they're in ICU, anything that they're immobilized, they can definitely get pressure ulcers. Peripheral vascular disease also. So I know this probably looks terrible, but it actually, this one is getting better. All right, we'll look at some more pictures and the stages, and then when I get back, we'll do a lab where I have a model of the different stages of decubitus ulcers. All right, so here you can see, the bony prominences. So the back of the head, the shoulder blades, the elbows, anything on the bottom portion of the body, the heels, and then on the hips, okay? So stage 1, and I'll show you a picture in just a minute. Stage 1 is where it is just the epidermis, okay, that's being affected. But what you have to realize is what you can see on the skin, there's actually more happening underneath. So all this looks like is a red spot. But the red spot does not blanch, okay? And when I say blanch, I mean, if you push down on your skin and then let up, it turns white for a second, okay? If you fall asleep on your desk watching this video and you wake up and you have a big red spot on your head, if you touch your head, it will blanch, it will turn white. A stage 1 pressure ulcer does not blanch, okay? So that means there is damage being done under the skin, and you better work fast with this patient or they're going to end up with a serious pressure ulcer. So this is why it is so important in turning your patients every 2 hours, and when you're bathing your patients, any of those things that you are looking at their skin. This is why with our program, you guys are being trained to, be some of you will take CNA next year as seniors or your senior year. Some of you will take CMA, Certified Medical Assistant. Some of you will take EMT. Some of you won't take any of those. You'll just take the second year courses, and that's totally fine too. But as a CNA, as a CMA, as an EMT, you're going to need to look at that patient's skin when you're assessing them, when you're doing any kind of care. So don't think, really and truly, the nursing assistants, they are our first line of, you are the first line of defense for that patient. It is such a huge role. And, so take that seriously. Look at their skin. If there's an area that doesn't blanch, if it's red and when you're washing it, it doesn't blanch, that's a problem. All right, stage 2, it has gone all the way through the dermis, the epidermis, the dermis, and now we're into the hypodermis. Okay, so this is starting to open up. You can definitely tell there's an ulcer there. Stage 3, you've gone all the way through the epidermis, the dermis, the hypodermis, and now you're into the muscle. Okay, so all the way through into the fascia. Now you may not be able to see all this, but it tunnels. They tunnel under it. I'll show you some pictures in just a minute. And then stage 4, you've gone through all the supporting tissues, and now you're to the bone. So remember, the skin is the first line of defense for infection. So now this patient is set up to have an infection in the bone, and an infection in the bone can be deadly. I mean, they can die from that. So yes, patients do die from bed sores. So this is why you have to catch it early. These patients need to be on IV antibiotics. Their wound staging is a whole job. Some people love wounds. There's a wound care nurse. There's a whole wound care team in hospitals. And so if I were to see a stage 1 on my patient that's there today, it wasn't there yesterday, then I'm going to put in a consult for wound care to come take a look at that and get a plan of care going. All right. So stage 1, pressure-related change to intact skin. The symptoms, yet again, redness that doesn't blanch. It'll be warm. There's a change in the skin temperature. And it looks literally something like this. So, you know, this could be from, you might just think, oh, that's from them laying on their back, or that's from them sitting up in the chair. But that area needs to be checked immediately to see if it's warm and to see if it doesn't blanch. If it's warm, it's fine. You know, it could have seriously been just where they were sitting on there. But if it doesn't blanch, that's a problem. And you would want to look at that area again and get them off of it. The biggest thing is to get them off of that area so that they don't continue to get pressure there. Stage 2, this is partial thickness of the skin loss involving the dermis. Symptoms, it's still superficial, may appear as an abrasion or a blister or a shallow crater. This starts to look like a burn, so you can see, you know, even though all of this area, so this is the part that's stage 2 right here, but you can, this part's all stage 1, and it's coming right along with it, okay? Actually, all of this is probably a stage 2, but you're starting to have, you know, a major issue going on here on your patient's skin. Stage 3, full thickness of the skin. Hypodermis goes into the fascia, may even be to the muscle. You've got major tissue damage here. You could even have possible necrosis. So think, what does neck mean? Neck means death. So tissue death here. It's going to appear as a deep crater. Okay, so this is someone's heel. So you can see it's gone all the way through the full thickness of the skin, and you can even see on this one it's tunneling back, and you see how this is dark here. That is some tissue necrosis. This patient would probably have to go to surgery. They would have to remove that dead skin to help this patient get better. All right, stage 4, this is the full thickness skin loss, and they are having some tissue necrosis. Symptoms, extensive damage to muscle, bone, and supporting tissues. This one is actually getting better. This is at a healing stage. You can see it's at a healing stage, but it did tunnel down all the way to the bone. But this tissue looks healthy now. But this was a stage 4 pressure ulcer. Looks like it could be on an elbow maybe. So how do we prevent these? So prevention is the biggest thing, because once it's going, it's so hard to stop. So we really want to try to prevent these. So turning your patient every 2 hours, lotioning the skin, you know, especially during bath, like really, you know, rubbing that skin, getting the circulation going. Heel, elbow protectors, air mattresses, egg crate mattresses, anything that protects from pressure. Pillow between bony prominences. If your patient is on their side, you know, they need a pillow between those knees so that they don't get pressure there. Remember, this is going to be your patients that aren't able to move around. Like, you're not going to get a pressure ulcer from sleeping on your side all night. This is a person that is sick, so they've got so many things going on. They're not eating, so they've got poor nutrition. Their mobility's decreased. If they're moving, it's because we're moving them. So definitely that pillow between their bony prominences. Then elevate those bony prominences off of the mattress. So those feet need to be elevated off of the bed, you know, part of the day. All right, the next portion is going to be quickly. This is when I come back, just remember we will have a lab that we look at these on a skin model, okay? All right, so bed positions, and these are just, you're going to need to know these. So there's really not a way for me to, put notes on these. You're just going to need to know them. That Fowler's position, that is at a 45-degree angle. So it'll be ordered in a patient's chart, that their position. If it just says position ad lib, that means they can be in any position they want. But if they have a certain position they want them to be in, then it's not going to say 45 degrees. It's going to say Fowler's. So you'll need to know what that means. So Fowler's position is 45 degrees. High Fowler's, this is a 90-degree angle. So this would be, like your patient that needs to be sitting straight up because of breathing issues or whatever. There would be a reason to do high Fowler's. Semi-Fowler's, this is 30 degrees. Patients that have, and like you guys, when you have your wisdom teeth out, what they're ordering when they say sleep on 3 pillows or 2 pillows, they're ordering to be at semi-Fowler's position, to just with the head of the bed elevated the first few days for swelling. All right, Trendelenburg, I don't know if you can see this here. It's actually the feet are up and the head is down. Trendelenburg is what you put someone in if they are lightheaded, if their blood pressure has gone down, if they're going to pass out on you or something like that, because that sends all the blood to the brain. So that is Trendelenburg, is the feet up. Reverse Trendelenburg is, and the stretcher does this, you can just hit a button and it goes from Trendelenburg to reverse Trendelenburg. Trendelenburg is if you're wanting the head up. Maybe this is a patient that, is choking or something like that, and you want to get them up as quickly as possible. You put them in reverse Trendelenburg. All right, so supine position, this is on your back. So if patient is laying on their back, they are in the supine position. Prone is laying on the stomach. So COVID, for whatever reason, we put patients in prone position all the time to do different procedures, like for surgeries and things like that. Like if we're operating on the back of the body, obviously they're going to be in a prone position. But with COVID, we've actually put, and this is what's been recommended for people that are really having issues or really, really sick, is for them to sleep in prone position. And this just keeps the fluid from settling in their lungs. And people that are on the ventilator will even end up in prone position with COVID. All right, this is Sims position, just basically on their side with one leg elevated, side lying. All right, last but not least, we're going to look at burns, and this is Burn Awareness Week. So anyway, I actually didn't know that until yesterday, but this is Burn Awareness Week. So burns, there's first-degree burns, second-degree burns, and third-degree burns. So you got your skin model here, so you can kind of remember the skin, the different layers of the skin. If you've ever burned your hand on a stove, a curling iron, a flat iron, a regular iron, or had a sunburn, you have had a first-degree burn. So most of us have had a first-degree burn. This is just, this is just superficial, just goes through the dermis, okay? If second-degree burn, this goes through a partial thickness. This is into the dermis. So if that burn that you've had has ever formed a blister, you've had a second-degree burn, okay? The second-degree burn, if you've had a sunburn that formed blisters, then you've had that was a second-degree sunburn. Then a full thickness or third-degree burn, this goes all the way through the full thickness of the skin. These are severe burns that come from, like fires, okay? So hopefully none of you have had a third-degree burn, but that's the full thickness of the skin, so you've gone all the way through the hypodermis. So here's a second degree, look, it's blistered up. So if you've ever had a blister from a burn, that area was a second-degree burn. Here's a second-degree burn also. Now, this does look like it probably came from a fire, but it's not didn't go all the way through to be a 3rd degree. This is a 3rd degree, so we're all the way through the full thickness of the skin into the hypodermis here. This definitely looks like it was from a fire or a chemical burn. This is a 3rd degree burn as well. This is going to leave scarring. This is a 4th degree burn. I mean, I'm not even sure if this person is alive where this picture is taken, but if it goes all the way to the bone. And I mean, people live with that, you know, I mean, if it's depending on how much of the body it is. And so that brings us to the rule of 9s. So you have heard they had the 3rd degree burns over 90% of their body or 45% of their body. So how do we get that? How did they come up with this? So the rule of 9s, this is a standardized method used to quickly assess how much of the body surface area, or BSA, has been burned. This only applies to partial thickness or full thickness burns. So only 2nd degree or 3rd degree burns is the only thing that this applies to. So those two things, we would use the rule of 9s. So this diagram depicts the BSA percentage for adults and infants 1 year or less, okay? Oh, wait a minute, infants 1 year or less. So this one is the adult. So if they're over a year old, you're going to use this one. So the head is 9%, each arm is 9%, 18% is the front of the body, 18% is the back of the body, each leg is 18%, and then the genitalia area is 1%. So if your arm was burned and your face was burned, we would say you had 2nd degree burns over 18% of your body, okay? If you have a burn on your front, like if we had a friend that spilled hot grease on his body, taking it outside. It was on fire. Anyway, he should have used a fire extinguisher or covered it or, you know, smothered it. But anyway, he was taking it outside. It spilled on him. He had 2nd degree burns on 18% of his body. All right, so the way that we treat burns, 3rd degree burns, is with a skin graft. And this is a surgical procedure to transplant healthy tissue by applying it to an injured site. I have a video for this that I'll post. This is the video. Oh, I'll find a video if this one's out. After this, this is someone who was burned severely, and this is after multiple skin grafts. So, you know, people that have been burned severely, they, you know, just try not to stare at them. You know, they know that they've been burned. They know that they look different. He probably even could have been a soldier of some sort. All right, and then last but not least is a physician who diagnoses and treats disorders of the skin. All right, so that's our integumentary disorders. Email me, text me, send me a remind about any questions that you have, and I hope to be back soon.